Hello, everyone, and welcome again to another quick nutrition session regarding nutrition for your injury recovery. So today we're going to take a look at specific nutrients, possible supplements that can help you with the healing process. And so let's jump right into it. So, overview real quick of what we've learned so far is that the importance of quality proteins, the importance of carbohydrates, healthy fats. Want to include all of those three food groups in every meal throughout your rehab process. Nutrients such as vitamins and minerals have different impacts on different types of injuries, and we're going to take a look at that. And then, depending on the injury type, some nutrients play a role in that. There's three phases. Pain and swelling, which is a phase number one, inflammation. This is probably the shortest one, and we learned a little bit about that already. Proliferation, which is tissue formation. New blood is a temporary tissue that gets built around the joints. And then the last will be remodeling, and this is where your body really starts putting together those strong cartilage, those rebuilding the ligament and collagen. So let's take a look at some of the main vitamins here. Will be omega-3 fatty acids, vitamin D, creatine, okay, for a specific injury, vitamin K, magnesium, collagen, which is the same as it could be bone broth or it could be gelatin, vitamin C, leucine, which we all know that this is a very important amino acid found in complete proteins, in quality proteins, zinc, flavonoids, and of course hydration, your water intake throughout the day to help absorb all of these nutrients. So phase one, typically the shortest one, 2 to 4 weeks, is generally where most of the inflammation after the injury occurs. It could be prolonged, but typically 2 to 4 weeks. And this is where we have to talk about managing that inflammation. Inflammation is good because your body is fighting something, and it's healing at the same time that is inflamed. But if we don't control it, too much inflammation can hinder that rehab process. So wound healing, protein synthesis will be the primarily goals as well. So quality proteins, flavonoids, and omega-3s. The foods that contain these, leucine, we know animal proteins, all of them will have leucine. And then from the plant-based will be the soy-based products, tofu or soy milk, pumpkin seeds, seitan, which is a wheat gluten, and tempeh. Those will be the ones highest in leucine. Flavonoids, on the other hand, are going to be those fruits and vegetables, specifically those that have deep colors, like carrots and deep colored grapes, for example. Citrus fruits are also going to have flavonoids, and this is just plays a role in managing that inflammation. Again, we don't want to completely avoid inflammation, but we want to manage it. And it's important to include these types of nutrients when it comes to this first 2 to 4 weeks. Omega-3s from fish, fish oil supplement, at least those with 2 grams of EPA and DHA and 1 gram of DHA, which is the fatty acid component that helps with the inflammation process. And research has shown to be promising on that end. And there is benefits taking fish supplements during this phase in particular. You can also get it through salmon, sardines, and mackerel. They have great amounts of omega-3s. Okay, so these are some of the important nutrients, specific nutrients found in food for the inflammation phases. So let's get into the second one here. This is a type of injury, bone joint injury. So now we jump into what are those types of nutrients that help recover those faster. And we look at calcium, vitamin D. Calcium, of course, important for maintaining the strength and the structure of the bones, and then vitamin D is needed for calcium absorption. So it's important to think about a vitamin D supplement during the winter time, and then if you're in the summer, make sure you get at least 15 minutes of sunlight on a daily basis to get the natural vitamin D. And research has shown that if you're your blood level of vitamin D is above 40 nanograms per milliliter in the blood, that prevents future stress fractures. So it's important to talk to your doctor about a vitamin D level, and just getting tested for that and see where you're at. And then vitamin K and magnesium, they work in cohesive with calcium as well, and they maintain the calcium balance in the blood. So foods, again, dairy, rich in calcium. Same thing with vitamin D. Dairies are going to be rich in those too. Other alternatives will be like anything that's fortified, juices or cereals, and then tofu, sardines, collard greens. All of those have calcium as well. Vitamin D, the fish, obviously, dried mushrooms, sardines, and then again fortified beverages like milk, even almond milk, soy milk, orange juice. Vitamin K and magnesium, almonds, beans, bran cereal, dark leafy green vegetables, pumpkin seeds. So again, they're all familiar foods, but if we can target these depending on the injury, it could help you regain some of this, again, some of the structures a lot quicker. It'll help the rehab process. Okay. And then this one is soft tissue injury. So this will be phase 2, phase 3 combined tissue building, remodeling. So again, it all depends on their injury. Muscle, ligaments, tendons are something that's part of it. Acute, from a sudden trauma or from overuse, right? Running with for several months with maybe not the best technique. Maybe you haven't been following a strength program, and then you put more stress in your ligaments. So that could happen chronically as you run or bike or other sports. So the goal after wound healing, if you had a mini surgery or surgery, inflammation, the goal after that is, all right, let's build the stronger tendons. And how do we do that? Well, a lot of research has shown that a combination of collagen, which is part of your cartilage, your ligaments, you get it through gelatin combined with vitamin C to help the absorption. 50 milligrams helps with the regeneration, with the remodeling, and maintain stronger ligaments. So it's important to time that 1 hour before your rehab session. Once you're past that inflammation stage, and then losing animal protein, again, soy, amino acid supplements, if you're strictly vegan, is very helpful. And the timing, again, throughout the day is important. Okay. Head injury, so concussion, primarily. There's specific nutrients that are that have been researched already, and with these supplements, you would probably need to sit down with your doctor, sit down with an RD like myself, and discuss the strategies and things that you might need, or these supplements, are they right for you? So omega-3 is, again, inflammation associated with brain is associated with brain injury, so it helps decrease that a bit. Creatine supplements maintains the cellular energy reserves in the brain. Your brain utilizes creatine for processes, and research shows that creatine is important for that. Zinc, reducing inflammatory markers in the brain. It has improved scores of the Glasgow Coma Scale. It's an assessment score of consciousness when it comes to post-concussion injuries. And flavonoids, again, those polyphenols found in these types of foods, again, all the plant-based, all the fruits, and then spices like curcumin have potential to decrease a lot of the swelling that occurs after concussion. So it's important to really think about these types of foods for head injury. So again, omega-3s in fish, creatine at the bottom. You can take it, synthetically, like creatine monohydrate, or include, foods that have natural creatine. It won't be enough, but again, it depends on the protocol. It depends on, your doctor's recommendations as well. Zinc, find in oysters, beef, fortified cereals, pork, beans, yogurt, All those are going to have zinc, and you should definitely hit that mark through food. And then flavonoids, right? Grapes, berries, citrus fruits, apples, green leafy vegetables, including those throughout the day. So the summary, I mean, specific recovery phases have different demands and specific nutrient needs. Uh, foods, again, that are similar across the board, right? We're talking about whole foods, minimally processed fruits and vegetables. There are some specific, strategies like the gelatin, 15 grams of vitamin C to create more, stronger cartilage, through collagen in the ligaments and tendons. But they're all pretty much, whole foods and a lot of, foods that have rich nutrients. And then, avoiding the foods that cause inflammation, like fried, the extra fat, the high sugar, obviously alcohol. We talked a little bit about how that hinders protein synthesis. So it's important to cut that out really from your diet during this time. And maintaining adequate intake, throughout the day. It's not just one meal a day. It's throughout the day, breakfast, lunch, dinner, and a few snacks. All right. Thank you so much again, and I'll see you on the next one.